Assalamualaikum guys, how are you? Our today's topic is about fracture of clavicle. As you know, we have started upper limbs clinical, so our first lecture in upper limbs clinical is about fracture of clavicle. Now we will see how it does happen when a person fall on outstretched hand, then a fracture of clavicle occurs. So as you can see in here in this picture, the person fall on outstretched hand and the tension leads to the clavicle bone and causes the fracture of clavicle. Not only it causes a fracture of clavicle, but also in arm it can cause colles fracture, and also in shoulder joint it can cause rupture of MCL ligament, medial collateral ligament. Okay. There are specific sites for fracture of clavicle. Let me discuss about it. Here we have a clavicle bone. Okay. Here we have a clavicle bone. So here one is a medial side and that one is a lateral side. So very common, and you can say the weakest part of the clavicle bone is a junction between middle and the lateral side. Here is a 80% of chances to happen a fracture of clavicle, and other one is a middle and medial side, medial junction. Here only 50% chances of fracture to happen. Okay, so here is the weakest part that is usually fractured are junction between middle and lateral thirds. We can say it is, in other words, we can say it is a middle and lateral two-third. Okay, so here is you can see in this picture, here is a junction between middle and lateral end, and here is a junction between middle and medial end. There is only 50% chances here, and there is a 80% chances here to happen, and only a 5% chances that is in group 3. Only 5% of chances occurs here. Okay, so let me discuss about mechanism. How does a fracture of clavicle occurs, and role of muscles and ligaments in fracture of clavicle. Okay, so when the clavicle is fractured, so the muscle sternocleidomastoid elevates the medial aspect of the bone. The medial fragment of the bone is elevated by sternocleidomastoid, and main function of trapezius is to support clavicle and hold it into its place. When the fracture of clavicle is occurred, then the trapezius is unable to hold the lateral fragment and the shoulder will be dropped. Okay, the shoulder will be dropped, and the very next movement, the lateral fragment may be pulled by adductors of arm. Okay, and other important thing about a fracture of clavicle is a broad shoulder. What is broad shoulder? As the fracture of clavicle is most commonly present in children's. The fracture of clavicle is most commonly present in children, especially during neonates delivery. Especially during delivery cases, in neonates, the broad shoulder happens because of fracture of clavicle during pulling the baby out. Okay, but don't worry about it. It heals quickly as it is a type of green stick fracture. Green stick fracture is it is a immature fracture of the bone. So it is a cortical disruption of bone, and immature fracture of bone heals quickly. That is with the passage of time. That is a feature of green stick fracture. Okay guys, so this is our today's topic. I hope you have enjoyed it and understood it. Stay tuned with us for further videos. Thank you.